A blood clot can develop in just a matter of minutes. A thrombus detachment is one of the most dangerous conditions that can occur suddenly and without warning. Everything that happens in the next 10 to 15 minutes could determine a person's fate. But here's the important part. The body almost always sends out signals. Subtle, alarming, yet recognizable. If you know how to identify these signals, you could save a life. It might be your own, or it could be someone close to you. Margaret was just walking through the kitchen. It was an ordinary day, with familiar tasks. Suddenly, she experienced a sharp dizziness, as if the floor had vanished beneath her feet. Then came numbness in her arm, a heaviness in her chest, and a sudden weakness. She didn't want to alarm her son and told herself, "It's just my blood pressure." But he insisted and called for an ambulance. By the time they were in the ambulance, the doctors confirmed it. A blood clot had detached, which could have led to a stroke. But they made it in time. Because someone knew this was more than just fatigue. Blood clots can form quietly over weeks or even months, especially in older adults, those with a sedentary lifestyle, varicose veins, or cardiovascular diseases. They can develop in both veins and arteries. But the most dangerous moment is when a clot detaches. It can block a vital vessel in the heart, lungs, or brain. This is no longer just feeling unwell. It's a crisis where lives are at stake. When does a blood clot detach? A blood clot detaches when a mass of blood that was previously anchored to the vessel wall suddenly breaks loose and begins to travel with the blood flow. When it reaches a narrow section, it can completely block the vessel. This causes oxygen deprivation to the organ that the blood was supplying, such as the brain, lungs, or heart. This can lead to serious conditions like a heart attack, stroke, or pulmonary embolism, where every minute truly counts. If symptoms are not recognized at the moment of detachment, the consequences can be irreversible. Loss of consciousness, paralysis, respiratory failure, or cardiac arrest may occur. What's most frustrating is that it often starts with a minor symptom that can easily be mistaken for fatigue or stress. If we don't learn to recognize these signs, we may find ourselves unprepared. Now, let's get to the most important part. We will discuss the signs that indicate the risk of a blood clot detaching. What symptoms might you feel in your chest, head, arms, or legs? And what immediate actions should you take without delay? This isn't meant to frighten you. It's knowledge that could one day become the most important thing you've ever learned. Please rate how useful you find this video on a scale from 1 to 10, and make sure to share it with your loved ones. They will be grateful. How can you recognize a blood clot detachment in its early stages? The initial signs of a clot detaching are often subtle rather than sharp, more like fatigue or general malaise. This is why they are frequently overlooked. However, the sooner we identify this alarming signal, the better our chances of preserving health and, in some cases, even saving a life. When a clot detaches, time becomes our most valuable resource. Your reaction in the first 10 to 15 minutes can make all the difference. Remember, your body always tries to warn you. You just need to learn how to listen. What happens when a blood clot breaks loose? When a clot dislodges, it starts to move through the bloodstream. If it blocks an artery or a vein, it disrupts the oxygen supply to organs. The body reacts immediately, and symptoms appear depending on where the clot travels. If it goes to the lungs, there may be sudden shortness of breath, a feeling of suffocation, and chest pain. If it travels to the heart, symptoms can include sharp pain, a feeling of pressure, anxiety, and possible pain radiating to the arm or jaw. If it reaches the brain, one might experience sudden dizziness, slurred speech, or numbness on one side of the body. If it lodges in a leg or arm, there could be sharp pain, swelling, paleness or redness of the limb, and a sensation of warmth. All of these signs are serious and require immediate medical attention. Here's what happened to a man. George, 78, woke up one morning with slight numbness in the fingers of his left hand. He thought he had just slept on it. Then he experienced a strange heaviness on the right side of his face. His wife noticed that he was speaking slowly and unclearly. They didn't wait. After 8 minutes, they called for an ambulance. At the hospital, it was confirmed. He was in the early stages of an ischemic stroke caused by a dislodged clot blocking a vessel in his brain. Thanks to their quick response, the consequences were minimal. Just a week later, George returned home. If they had waited, it would have been a different story, his doctor said. If you notice any of the symptoms described, don't wait. Don't take a pill. Don't lie down to rest. Call emergency services. While you wait for help to arrive, open a window or ensure fresh air is flowing in. Don't eat or drink anything. Sit in a comfortable position. If you feel dizzy, don't lie down. If you experience shortness of breath, breathe slowly through your nose. If you have aspirin and are sure there are no contraindications, place half a tablet under your tongue, only if you have chest pain. Important. It's better to be wrong once than to be too late. If your concern turns out to be unfounded, you've just taken an extra step to take care of yourself. If it's confirmed, you'll already be one step ahead. What's most important? Blood clots don't just appear out of nowhere. In most cases, they form gradually in response to a sedentary lifestyle, hidden inflammation, metabolic disorders, or heart issues. Often, a person isn't even aware they're living on the edge until a clot makes its presence known. Knowing the risk factors isn't a reason to be afraid. It's a tool. If you know you belong to a risk group, you gain the power to take control of the situation and reduce the threat. Why does this happen? As we age, our blood vessels lose elasticity and blood flow slows down, especially if we lead a sedentary lifestyle. Under these conditions, blood can thicken, leading to the formation of clots in the veins of the legs. There are also other factors that significantly increase the risk of thrombosis: varicose veins and venous insufficiency, previous surgeries or injuries, especially to the limbs, a sedentary lifestyle, particularly during long periods of sitting, e.g. while traveling, obesity, diabetes, high blood pressure, elevated cholesterol levels, the use of certain medications, hormonal, pain relievers, smoking, cancer and chemotherapy, heart failure, arrhythmia, and atrial fibrillation. The body gives early signals: heaviness in the legs, swelling by evening, nighttime cramps, and numbness in the limbs are all reasons to pay attention. Here's an example. Peter, 68, always considered himself healthy for his age. Yes, he had varicose veins and some extra weight, but overall he felt fine. That was until one day on a plane, after 4 hours of sitting, he felt a strange pain and warmth in his calf. At first, he didn't think much of it. An elderly man seated in an airplane near the window, subtly grimacing as he looks down at his leg. One hand is massaging his lower calf, while the other rests on the armrest. His expression shows anxiety. The warm cabin lighting blends with soft daylight coming through the window, creating an emotionally quiet yet tense moment. The focus is shallow, with cinematic shadows and highlights adding depth to the scene. 2 days later, there was redness, swelling, and the leg was swollen. At the hospital, they diagnosed deep vein thrombosis. The doctor was blunt. If you had waited just a couple more days, the clot could have dislodged and traveled to your lungs. Since then, Peter has been doing simple exercises every day, drinking more water, and paying attention to his veins. I've realized that ignoring your body can be the costliest mistake, he says. So, what should you do, you might ask? If you recognize even one risk factor in yourself, start with these simple steps. Move every hour, especially if you sit for long periods. Roll your feet, lift your heels, bend your legs, drink water. Dehydration thickens the blood. Keep an eye on your weight and reduce sugar in your diet. Wear compression stockings if you have varicose veins. Get your blood clotting tests, D-dimer, fibrinogen, cholesterol, done at least once a year. Discuss with your doctor if you're taking medications that affect blood flow. And most importantly, don't procrastinate. Even a simple morning walk or stretching at home before breakfast gets your blood flowing. That's already a step toward a healthier life. You can reduce your risk yourself. Here's how. When it comes to blood clots, many people think of them as sudden and unpredictable, something that just happens to them. But the truth is, we can influence this risk every day without pills, injections, or anxiety. Simple, regular actions, movement, nutrition, breathing, and routine keep our blood flowing, our vessels elastic, and our bodies protected. The key here isn't intensity, but gentle, daily self-care. What happens when we move? When we move, even just walking around the room, the veins in our legs pump blood back to the heart. This reduces stagnation and the risk of clotting. When we breathe deeply, especially with relaxed abdomens, the diaphragm massages the veins in the abdominal cavity, helping blood circulate more actively. And when we drink enough water, our blood becomes less viscous, allowing it to circulate more easily and reducing the formation of clots. All of this works not just in theory, but right now, within each of us. Here's a simple yet vivid example. Anna, 74 years old, used to wake up with swollen legs, a feeling of heaviness and anxiety about long trips. Following her daughter's advice, she established a movement routine. A light walk around the room every 45 minutes, morning breathing exercises, and a glass of water with lemon. After a week, the swelling in her legs disappeared, and by the end of the month, she decided to visit her sister in another city. I realized that my health depends not on the doctor, but on me, she said while stretching her foot by the window. Here's what you can start doing right now, easily and effortlessly. Walk or roll your feet every 30-60 minutes, especially if you sit a lot. Elevate your legs on a pillow for 15-20 minutes in the evening to improve venous drainage. Practice belly breathing for 3 to 5 minutes a day to stimulate blood flow. Drink a glass of warm water with lemon in the morning and throughout the day to improve blood fluidity. Perform a gentle self-massage of your legs from bottom to top, especially before bedtime. Nutrition. Add garlic, onions, greens, turmeric, lemon, and ginger to your diet as they naturally reduce clotting and enhance circulation. Cut back on sugar and processed foods, especially in the evening. And most importantly, make sure to get at least 7 hours of sleep. It is during sleep that the regeneration of the vascular wall and normalization of metabolism occurs. Now listen carefully. What triggers blood clots? Sometimes we try to stay active, drink water, but still feel heaviness, discomfort, and fluctuations in blood pressure. Why is that? Because there are certain foods that literally thicken the blood create inflammation, and disrupt vascular function. Even if you consume them in small amounts, your body, especially as you age, can feel the effects right away. If you have a predisposition to blood clots, your diet becomes either a support system or a risk factor. It's important not to be afraid, but to make conscious choices. Avoid these foods. Sugar increases insulin levels, causes inflammation of the blood vessel walls, and thickens the blood. Fatty red meats and processed meats contain saturated fats that raise cholesterol and promote plaque formation. Margarines, fried foods, and trans fats disrupt cell structure and lead to chronic inflammation. Excessive dairy products can lead to thickening of the lymph and mucus formation, especially in sensitive individuals. High salt intake retains water, raises blood pressure, and disrupts the balance of sodium and potassium. Alcohol, in small doses, dilates blood vessels, but in larger quantities, it causes blood to thicken sharply and weakens the liver, which is responsible for cleansing the blood of excess coagulants. The body becomes overloaded. Blood circulation slows down, blood vessels become inflamed, and cells do not receive enough oxygen. A very enlightening story. Grace, 70, started eating on the go after losing her husband. Sandwiches, processed meats, and sugary yogurts. She began to gain weight. Her blood pressure increased, and she experienced shortness of breath even at rest. After an episode of chest pain, she was hospitalized, and venous thrombosis was confirmed. While in the hospital, she was told that diet is a key factor. Now she keeps a food diary, adds vegetables and greens to every meal, and has left processed meats and baked goods behind. I realized that taking care of myself isn't about being strict, it's about being genuine, she says. Here are some steps to make your diet an ally in preventing blood clots. Replace red meat with fish, legumes, eggs, and plant-based proteins. Eliminate margarine and fried foods. Cook by steaming, baking, or braising. Cut down on sugar, especially in drinks and processed foods. Add anti-clotting foods like garlic, ginger, turmeric, lemon, dark berries, and green vegetables. Use natural fat sources such as olive oil, avocados, flax seeds, and nuts. Drink warm water and herbal teas, adding lemon and mint. They help thin the blood gently, and most importantly, don't eat on autopilot. Ask yourself, does this food heal or burden me? In addition to foods that thicken the blood, there are also foods that safely and gently thin the blood every day. Many people think that thinning the blood is only about pills and doctors. However, nature has long created its own remedies that help keep the blood flowing and the vessels clear. These are foods you can eat daily without fearing side effects. They aren't exotic, but are easy to find in a regular grocery store. The key is to know how and with what to combine them. When blood becomes too thick, it moves slowly, creating excess pressure that can damage blood vessel walls and increase the risk of clots. Foods containing natural anticoagulants help maintain balance. Garlic activates enzymes that prevent platelet clumping. Ginger improves microcirculation and reduces inflammation. Turmeric, especially when paired with black pepper, decreases clotting due to curcumin. Lemons and limes, rich in vitamin C, improve blood flow. Berries, especially blueberries, raspberries, and cranberries, contain anthocyanins that strengthen blood vessels. Extra virgin olive oil is rich in antioxidants and lowers levels of bad cholesterol. Tomatoes contain lycopene, which enhances blood circulation. Dark chocolate, 70% cocoa or higher in moderation, dilates blood vessels and boosts mood. Incorporating these foods into your daily diet can help naturally regulate blood viscosity without overburdening the liver and kidneys. Louise, 69, became fearful after having a stroke, afraid of food, walks, and even sleep. Her doctor prescribed medications, but she wanted to be an active participant in her recovery. With the help of a nutritionist, she developed a simple plan: garlic for lunch every day, lemon water in the morning, berries with oatmeal, and a drizzle of olive oil on her salad. After 2 months, her health indicators improved, and her well-being became stable. "I felt like I was in control of my life again," she said with a warm smile, stirring her turmeric-infused soup. Where to start? Begin simply. In the morning, have warm water with lemon and honey. For breakfast, enjoy oatmeal topped with berries and a pinch of fresh ginger. For lunch, a salad with olive oil, garlic, and ripe tomatoes. For dinner, steamed vegetables with turmeric alongside a slice of fish and a wedge of lime. For dessert, a piece of dark chocolate and a cup of herbal tea with mint. Imagine a flat lay of a rustic wooden kitchen table set with a full day of gentle, healing meals: a steaming cup of warm water with lemon and honey, a bowl of oatmeal adorned with berries, and a sprinkle of fresh ginger, a midday salad drizzled with olive oil, garlic, and bright cherry tomatoes, a plate of steamed vegetables seasoned with turmeric next to a slice of baked fish with lime, and a square of dark chocolate paired with a cup of mint herbal tea. Beside the dishes lies a handwritten card titled "Start Simple" and a linen napkin. The atmosphere is warm and nostalgic, illuminated by soft golden hour lighting. Natural sunlight streams through a wooden-framed window, casting cinematic shadows across the table. The cozy vintage setting evokes an emotionally nourishing and peaceful tone. Important: if you are already taking blood-thinning medications, like warfarin, be sure to consult your doctor to avoid any interactions. However, in most cases, these foods can be used as a preventive measure in a gentle and regular manner, as part of a sensible diet. They should not replace medications, but can serve as supportive additions. Let's summarize. We've traveled a journey where we've learned not just facts, but how our bodies communicate with us. They never stay silent. They whisper through feelings of fatigue, dizziness, heaviness in the legs, and shortness of breath. Sometimes they scream in moments of pain, anxiety, or panic. And they speak the loudest when there's already a brewing threat in our blood vessels. But most importantly, we've discovered that we have much more influence over our health than we tend to believe. The term thrombosis may sound frightening, but it carries more than just fear. It embodies the power of knowledge, the strength of choice, and the importance of care. Because every day is an opportunity to take actions that can protect us and our loved ones. Everything you've learned today is not just theory. These are tools. You already know what the early signs look like and which symptoms should never be ignored. Who is in the at-risk group? Which simple actions and foods can help reduce blood thickness? And which foods are better to avoid if you don't want to take risks? This is the solution. No extremes, no fear. Just mindfulness, just care, just consistency. The body doesn't ask for much. It doesn't need perfect conditions. It needs your support. Through movement, through breathing, through a glass of water, and through what you put on your plate. You might be thinking, "But I'm already so old. I have health issues. It's too late to change anything." But that's not true. It's never too late to signal to your body that you care for it. Your body doesn't blame you. It doesn't punish you. It simply waits for you to give it a little more oxygen, a bit more movement, and a little less overload. And it will respond gently and gradually. This isn't about healing. It's about starting to live more easily, Even if you're already on medication, everything we discussed can work alongside it. Because food, water, breathing, and rest are the universal languages that every body understands. So start small. Tomorrow morning, take a walk around your room. Drink a glass of warm water with lemon. Elevate your legs on a pillow in the evening. Read through the list of symptoms and memorize the 34 key signals. Also, talk to your loved ones. Explain to them why you're no longer ignoring that strange weakness or heaviness in your chest. You might just be the person who helps someone else not overlook their own life. And share this video or this story. Let it reach those who think it doesn't concern them, because knowledge shared with love can save lives. Now imagine this. It's morning. You wake up without pain. Your body feels light. Your mind is at peace. You walk to the window, and warm light brushes against your face. In the distance, you can hear birds chirping. On the table lies simple yet nourishing food: water, greens, lemon, and a few seeds. And you are not on the path of illness. You are on the path of life. You are not fighting. You are not waiting for a miracle. You are simply living in harmony with your body, in sync with movement, with breath, with nature. And all of this became possible the moment you chose not to fear, but to take action. Gently, patiently, with love for yourself.